Tonight,
I really had no symptoms.
He is a poster child of why men should get screened for prostate cancer.
It's a silent disease.
an ABC 27 special presentation.
My goal was to get back for Hockey Fights Cancer. It was nice to be able to say, I had cancer, I took care of it, I'm standing here, you can do this as well.
Prostate Cancer, a matter of facts, sponsored by Penn State Health.
Good evening, I'm Deborah Pinkerton. Prostate cancer is a significant health concern for men. Tonight, specialists from Penn State Health are here to talk about the importance of getting tested early and annually for prostate cancer. In the United States, prostate cancer is the second most commonly diagnosed cancer among American men. In fact, about 1 in 8 will be diagnosed with prostate cancer during their lifetime. All men are at risk of developing prostate cancer, but that risk increases significantly as men grow older. Tonight, doctors will answer some very important questions like, why is screening for prostate cancer so important? What are the latest treatment options for prostate cancer? And what type of support care is offered to survivors? And if you have questions at home, Donna Kirker-Morgan is here to tell you how to get them answered. Hi, Donna.
Hi, Deborah. Yes, we have the web chat live right now with 2 doctors from Penn State Health ready and willing to answer your questions. We have Dr. Roderick Clark as well as Dr. Jaime Herrera Caceres, urologic oncologist from Penn State Health, and they'll be here until 8 o'clock tonight to answer your questions live. So get those questions in. To do that, you go to abc27.com/prostate chat. And we'll be back in a little bit to find out some of the questions that have come into the doctors. In the meantime, it's back to you, Deborah.
Thank you, Donna. Statistics show a man is diagnosed with prostate cancer every 2 minutes. A Lebanon County man never expected to be part of that statistic. Jim Jones shares his journey.
This year. You're a big winner. Congratulations. Have fun. We look forward to seeing you in the playoffs.
A familiar face and voice of the Hershey Bears, Jim Jones, better known as Jonesy.
In hockey, everybody's got a nickname. So if you go to the rink or you'll hear it, let's go down to Jonesy on the ice, or Jonesy, what's going on?
A nickname that's been around since the 1990s when Jim got involved with game night entertainment during the Hershey Bears games.
It's kind of morphed into a different role now where interviewing players, interviewing coaches, being part of the broadcast team on game nights in the third period, being one of the analysts between the benches in the third and getting to call the action with Zach Fish and Mitch Lamoureux.
Jim has been with the Bears when they captured 5 Calder Cups, including the latest one in 2024. While the Bears won the title, Jim had his own personal health battle to defeat. Help came from doctors he knew both on and off the ice.
Matt Silvas is my primary care physician, and he is also the Bears' head physician as well, and part of our medical staff. And Matt is also a good friend of mine.
For adult men over the age of 50, or some people say 55, we recommend prostate cancer screening. And there's a blood test that you can get called a PSA.
I had a prostate exam every year, and he saw something that he thought was a little abnormal. We kind of went back and checked it a few months later. It looked a little bit more abnormal, so we win the cup. And his recommendation was to go and contact Dr. Jay Raman, who is the head of urology here.
I know Dr. Raman well. We all work here at Penn State Health and work collaboratively. So I contacted Dr. Raman immediately after detecting the elevated prostate blood test for Jim.
Jay and I met in April, and we kind of had a consult where I had an exam, and he wasn't sure, but to be safe, for my safety and my wife's, we did an MRI at Penn State in Lancaster. There was a small shadow. Just to be safe, he wanted to do a guided biopsy.
We always ask, do you need to have a biopsy? And his story fit together. His numbers were going up. The MRI showed some areas. So I said to him, look, I think you really need to have a biopsy. I don't know if this is prostate cancer, but this will help us find out.
We did the biopsy, and he was on his way to Peru. And he said to me, I'll get a hold of you in a week. I don't think it's much, and we'll take it from there. He called me 2 days later and said, I'm shocked to tell you, but you have prostate cancer.
I sort of looked at my charts and I saw his results, and he had been diagnosed with a more high grade and type of prostate cancer, multiple areas in the prostate, more aggressive.
It takes your breath away when you hear that, because there's no history in my family at all.
I don't love to always just give people news over the phone, but even a quick call to say, look, here's what I saw, this is the plan. When I get back, I'll see you. And I think at least goes a long way in just, comforting people for that 1 or 2 weeks until the next step.
The next step was a prostate cancer-specific PET scan.
This really showed, thankfully, that there were areas in the prostate that were lighting up, but not elsewhere. And that really gave us confidence of saying, look, this is localized disease. So Jim, you have the type of prostate cancer. It is a more aggressive type of prostate cancer, but it hasn't spread. So we have a window here of cure.
My decision, along with my wife's, was to go for the surgery. It seemed very early in the journey. And on November 11th of last year, I had my prostate cancer surgery right here.
The surgery is called robotic surgery. So we're basically doing minimally invasive surgery, but we're using a robotic platform. So the great thing about robotic platforms is 3D visualization. And you can really manipulate the instruments much like you're manipulating your fingers, and bring a camera maybe about an inch away from your target. So visualization is great, precision is great, blood loss is lower.
So I was diagnosed with prostate cancer early this summer.
2.5 weeks after the surgery, Jim was back on the ice for the annual Hockey Fights cancer event to share his journey.
It was a little hard to get through, but it was nice to be able to say, look at me, I had cancer, I took care of it, I'm standing here, you can do this as well, but pay attention.
I hate to use the word poster child, but he is a poster child of why men should get screened for prostate cancer.
I feel fantastic, and I feel like it's a gift. Life is a gift, and I have a feeling that I was given an extra card in the deck to play, and I'm going to use every bit of it.
And Jim is doing so well. He now uses his famous voice to urge other men to talk with their family providers and get their PSA checked. And joining me right now is Dr. Jay Raman, chair of the Department of Urology at Penn State Health and also Jim's surgeon. So we just heard about how important that PSA test was for Jim's diagnosis. Explain why this is such an important tool as far as diagnosing prostate cancer.
Yeah, I think when you look at prostate cancer, it's very common in men. But the reality is that a lot of prostate cancer is treatable and curable if you identify it early. And the PSA test is really critical for that. It sort of picks up if there's a problem before somebody has symptoms, maybe before things have advanced. So really important for men to get that first PSA, 50 to 55 years of age. And if they're a higher risk person, maybe Black African American race or family history, maybe 5 or 10 years earlier.
But definitely communicate with your family doctor. And that's in fact what he did. He had a great relationship with his family physician, Dr. Matt Silvis, and you two worked together under the same roof. So it makes it so much easier to communicate when you have this situation.
Yeah, it really does. I think your point's a really good one, which is I think in some regards, patients need to advocate for themselves and ask if they've heard about something like the PSA test. I think the other part of it is collaboration is key. The reality is, as a specialist, I might see patients that come into my office with a referral, elevated PSA, prostate cancer, but I really rely on Dr. Silvis and our primary care colleagues to have that discussion, to talk about screening, to talk about health maintenance, get the screening tests, and then having it all under the same roof means that all the things that Dr. Silvis looks at, I can see, all the things that I do, he can see, and I think ultimately that probably translates to better care.
Certainly. And when a patient comes in and they are diagnosed with prostate cancer, what are the things that you really want to take care of first and foremost?
Yeah, I think whether it's prostate cancer or any cancer, it's just a frightening diagnosis. And I think it's very anxiety provoking. And I think the first thing that's really important is reassurance. This is treatable, this is manageable, and that's true for 95% of prostate cancer. I think the other important thing is to just break it up into bite-sized pieces. Diagnosis, okay. Staging, okay. Then let's talk about treatment. And I think by breaking it up, it makes it a little bit easier for patients versus just getting overwhelmed with all of the information that might be out there.
And that's certainly what you did as far as in Jim's case. You gave him some reassurance. Let's talk about the treatments.
Well, probably in the last 15 years, there's just been a remarkable evolution of all the things available for men when the prostate cancer is localized. We now know that a lot of prostate cancer is slow growing or indolent, so maybe observation or surveillance would be very reasonable. Certainly surgery has very much improved and evolved over time, the Da Vinci robotic system. But now we can even offer HIFU, which is high intensity focused ultrasound, which is a non-surgical procedure where we can treat just areas in the prostate without having to maybe take out the entire gland. And then I'd even say radiation has evolved a great deal. Better technology, better equipment, better targeting. And so I think all of these things translate to better options for patients and better care.
And research plays a huge part as far as progressing treatment and all of these other options. It is wonderful to have Penn State College of Medicine right in our backyards. How does that really help you with your mission?
Yeah, I think research is sort of the cornerstone of progress. So when you think about the standard of care, what we do, and then you say, how do we do better? Or what can we do to improve the care? That's research. And I think that allows us to look at new diagnostics, new treatments, new ways to evaluate patients, clinical trials that may offer patients something that maybe isn't part of the routine standard of care. And that's really the beauty of being affiliated with a College of Medicine, is we can talk to patients about everything that's standard of care and then maybe the latest and greatest that they may benefit from.
Yeah, certainly a benefit for patients.
Absolutely.
Dr. Raman, thank you. We are going to be talking with you a little bit later in the show.
Great, thank you.
And if you would like more information, or if you would like to schedule an appointment with the Penn State Health Prostate Cancer Team, you can call this number 717-265-8585 or visit online at pennstatehealth.org. Now let's check in with Donna Kirker-Morgan. Donna, what are some of the questions being asked?
Deborah, there's a wide range of questions coming into our doctors from Penn State Health, urologic oncologists, and we're going to start with Dr. Herrera Caceres. This particular viewer says their dad had prostate cancer. Does that put them, or that person, that male, at higher risk? And should I be tested sooner than other men? And are there other risk factors to all this?
Thank you, Donna. Having a family history of prostate cancer can increase the risk of developing or having prostate cancer in the future, of course. And the recommendation would be that if you have a high risk of developing prostate cancer, such as a strong family history, having 2 or more related relatives with prostate cancer or certain genetic mutations, then you should start doing screening earlier than the general population. But overall, we recommend to start screening around age of 45.
When they have a history in the family.
Overall, in the general population.
Should you do it earlier if they have a history?
In certain cases. It's something to be discussed.
Okay, with your doctor.
Correct.
Here, this viewer asks, are urinary symptoms like urgency, frequency, or even incontinence a sign that this person might have prostate cancer?
In reality, prostate cancer, it's usually asymptomatic. You don't have any, you don't feel anything, you don't really notice anything. And those symptoms are more related to an obstruction of the bladder outlet due to prostatic growth, which can be benign, not necessarily cancer. So I would recommend to have a chat with your doctor.
Well,
yes.
Thank you, doctor. You're going to be here until 8 o'clock tonight answering questions along with Dr. Clark. If you have questions, please go to and submit those questions to abc27.com/prostate chat. And we'll be back in just a minute.
You're watching Prostate Cancer, a Matter of Facts on ABC 27, sponsored by Penn State Health.
Welcome back. Joining us now is Dr. Matthew Kaag, Chief of the Division of Urologic Oncology at Penn State Health, and Greg Sherwood, a prostate cancer survivor. Thanks for being with us. Greg, why don't you talk to us about your journey with prostate cancer?
Well, my journey it started when I was 50 years old, and I haven't been to a doctor in probably 10 years.
Not a good thing.
I know, I admit it. My doctor friend said, Greg, you need to come into my office. You haven't been to a doctor in a while, and we're going to do a full physical. So they say they found a little high blood pressure, and they drew some blood, and they said, we're going to check your PSA. I didn't even know what PSA was at that time. and it came back high. It came back 5.3, 5.4. And thus, I was in the transition moving to Boston, and I figured I'll wait and I'll just get treated when I get to Boston. And so I ran into another doctor on the golf course, and I said, look, I've been to the doctor, it's been 6 months, and I have this PSA problem. He happened to be a urologist. And he said, Greg, you need to be in my office, like ASAP. And I showed up, and we did the blood test, and next thing I know, the blood test showed PSA near 7. Red flags went up, and I ended up with a biopsy. And that after the biopsy, they showed that I had cancer. Shocked me, needless to say. Right. And the Gleason score, which I know a lot about now, was 6. So what that meant was they put me on active surveillance. So I would go to my doctor every 6 months and get checked out.
Okay, and that was the plan. So Dr. Kaag, this really shows the importance of getting screened early.
It does. So screening is testing for a disease before it becomes symptomatic in the hopes that we can provide either less treatment or better treatment with a higher chance of cure. And in prostate cancer, the disease doesn't show symptoms until it's quite advanced. So it's very advantageous to get it checked and find out about it early.
So he was on high surveillance. So talk to us about that. How does that work?
So we understand now, much better than we did even 10 or 20 years ago, that prostate cancer doesn't kill every patient that it affects. In fact, many men are going to live out the rest of their lives with prostate cancer, but not die from it. And so active surveillance is a way to avoid over-treating patients, operating on patients that might not need it. So we're able to grade and stage the cancer and understand what the risk to the patient might be, and then potentially not treat and simply watch.
And then at some point, Greg, something had to be done.
That's correct. I moved from Boston in 20. I moved from Boston to Mechanicsburg in 23, and I know I needed to follow up on my condition. And I had been recommended by my doctor in Massachusetts, who graduated from Penn State, and he said, you got to go find Dr. Raman. So I went on a search to find Dr. Raman. Thank God I did. And he said, Greg, we're going to start from the baseline. I got all your records here. He actually showed me on my MRI on his computer. He said, we got a hot spot right there. And we're going to do the blood test. The blood test showed higher PSA. We did a biopsy. The biopsy came back, and Dr. Raman said, Greg, your scores went up. Now I got 7. I'm in a 7, but I had a 7.4 instead of a 3.4. One of them came back, which is more aggressive. Dr. Raman sent me to get a PET scan, and which is nuclear medicine, and the PET scan came back that it showed the cancer, and it showed 2 spots on my pelvis. That was unbelievable because that was spread. You know, suspicious of the spread, the 2 spots. Dr. Raman, next couple days, I ended up in a bone scan, just a couple doors away from where I did the PET scan, and they focused on my pelvis. That was a Friday. I'll never forget it. And I know Dr. Raman was 6 o'clock at night. He was driving home, and he called me. And I know he wasn't looking for my test. That's the kind of guy he is. And he said, Greg, I got some good news for you. They didn't find the 2 spots.
Wow, wonderful.
Yes.
Wow. But you did end up having surgery.
January the 30th, 25, I had my surgery. And yeah, so far, so good.
That is wonderful. The bottom line is that you do need to have this screening, and Penn State Health is offering free screening. Dr. Kaag, tell us about that.
We are. We open our clinics after hours and invite men, usually age 50 and over. You heard Dr. Raman refer to the ages that we typically screen. So 50 and over is what's generally recommended. Patients with a family history or at higher risk because of African American descent can be screened as early as 45 or 40.
And what is your advice to men watching saying, I may not want to do something like this. You know, I'm scared. What advice do you have for them?
I think cancer is scary to anybody. I think that, you know, the worst thing that we can do is kind of put our heads in the sand and not acknowledge it. I think it's important to understand that just because your PSA comes back high doesn't mean that you have cancer, and just because you have cancer doesn't mean you need to have surgery or radiation. The screening acts as sort of a jumping off point for us to start the conversation in patients that might have cancer, so that they get tested, the appropriate testing, just like he had, and get the treatment that they need.
Yeah, absolutely. Some wonderful advice. And Greg, thank you so much for sharing your journey. Thank you both for being with us this evening. If you would like more information, you can, or if you would like to schedule an appointment with the Penn State Health Prostate Cancer Team, you can call 717-265-8585 or visit online at pennstatehealth.org. Let's check in with Donna and get more answers to our web chat questions. Donna?
Yes, we're going to go right to Dr. Clark and find out what this viewer is asking. They are asking, can you explain some of the newer procedures like robotic surgery and HIFU that are used at Penn State Health and whether they can be used in all patients?
So we're lucky at Penn State to have the traditional treatments like surgery and radiotherapy that treat the whole prostate, as well as some new treatments like HIFU or high intensity focused ultrasound that just treat part of the prostate and the cancer there. And so those are offered to certain patients, and as I said, we're very lucky at Penn State to be able to offer those to our patients.
Does it make the procedure a lot easier on them in some cases?
I think the HIFU procedure has less side effects. Now it does have to be in selected patients, but we're always happy to discuss those with patients.
And this viewer is asking, if someone is diagnosed, how important is it to get a second opinion and make sure you have the right doctor for your care?
I always want my patients to feel very comfortable, so I hope that people feel comfortable with both their treatment and their urologist, and I think it's really about establishing a good rapport for people. That being said, if my patient asks for a second opinion, I'm always happy to give it, because I do want them to feel good about things.
Thank you, Doctor. And you guys are here until 8 o'clock answering questions live on the web chat. We're going to send it right back to you, Deborah.
And thank you, Donna. Joining me again is Dr. Jay Raman, Chair of the Department of Urology at Penn State Health. So when we talk about survivorship care, we're really talking about things like emotional support, ongoing surveillance, lifestyle programs. This is almost as important as surgery itself.
Yeah, I would say as important, maybe even sometimes more important. You know, I think surgery, radiation, hormonal therapy are obviously critical to help patients get a cure for their cancer. But when I think about longevity, I really think about emotional support system, family, friends, loved ones. I think about taking control of your life with diet, nutrition, exercise, and then obviously being vigilant about your follow-up, getting the labs checked in case the cancer comes back, picking it up early so that the salvage or the treatment options are as good as possible.
Now we're soon going to be celebrating No Shave November. That's coming up in November. Those funds really expand different programs for survivorship. Talk to us about that.
Yeah, you know, when I think about who contributes to No Shave November, it's patients, families, businesses, all in Pennsylvania. And so I think we decided that some of the dollars we raise need to go back into the community. Some of it is to build up our prostate cancer survivorship group, have some great speakers that come in and really help educate our patients on options. We talked a little bit about screenings, and I would say one of the high points for me is this summer we had a screening at St. Joe's in Reading, and the number of screened men tripled from last year to this year. So I really think that we're getting the message out, and I think the funds are really going to who donates them, which is men in our community.
Yeah, that is wonderful. Now you're going to be celebrating your 10th anniversary of No Shave November. What does this milestone really mean to you, your partner, Mid-Penn Bank, and the community?
Yeah, I have to give a lot of credit to Rory Retrieve, who's the president of Mid-Penn Bank, and his team, who really engaged with us 10 years ago, bought into the whole idea of helping raise money for education, research, community awareness. And I think more than the money that we raise, and don't get me wrong, the money is great, but it really helps get more people involved. It starts the conversations about, you know, what is No Shave November? Should I get checked? Should I see my primary care provider? What are screening tests? How do I lead a healthy lifestyle? So I really think it helps get the message out.
What's in store for the big 10th anniversary?
Yeah.
This is something the community can certainly get involved with.
Can certainly, in fact, we count on the community getting involved. I think it's one of the great fundraisers because it's not a few individual people. It's actually, I think, close to 800 or 900 people all through the area collectively donating. And I guess I would say Rory sent me a message. He texted me in about June, July, and he said, 10-year anniversary, we got to blow the doors off this year. Wow. And so I think it'll be a lot of fun. We've got some fun kickoff events, some mid-month events. Our team's put together a great silent auction with some fun sports memorabilia, some fun sporting events, maybe even some destination trips that are out there. And I think, at the end of the day, maybe we can even, take advantage of Jonesy and his connections, get the Bears and maybe some of the other sports franchises involved. Wow. Should be a lot of fun.
It will be a lot of fun. Dr. Raman, thanks so much for being with us.
Thank you.
And we do send a special thanks to Jim and Greg for sharing their personal stories, and you, our viewers, for sending in your questions. If you would like more information, or if you would like to schedule an appointment with the Penn State Health Prostate Cancer Team, you can call this number 717-265-8585 or visit online at pennstatehealth.org.